I'm Deborah Szebeko, and I'm the founder of thinkpublic, and we're a social design agency based in the UK. Today I want to start my presentation by asking you all a question. And I've also got a Twitter address, and throughout the presentation it would be great if you could tweet me your responses too. If you could design anything to improve the way we live, what would it be? So if you have a think about this now, and whilst I'm speaking, but also I think from all the presentations here over the next few days, I think it's such a really important question, particularly for some of the design students and graduates within the audience. So we're a social design agency. We work with the public and third sector within the UK, and we work to use design to tackle social issues and redesign public services. This picture here contains some of the people that we've worked with in the past. They're not my design team. My design team are much younger. As a company, we're made up of designers, entrepreneurs, artists, filmmakers, anthropologists, and we've also got a public policy expert as well. So we're quite an unusual mix of team. This is a picture of me when I was 7 or 8. I was a bit of a geek, and probably like quite a lot of designers here, I just love drawing, mainly drawing elephants. I put this picture in because I think I've had quite an unusual path to actually starting my own business and working in this area. So my background is in graphic design and advertising. And I studied that as a bachelor's, and I graduated and worked in advertising for about 9 months, not very successful to be honest, and went back to study an MA in communications because I really felt that I wanted to do something social, but I wasn't quite sure what that was. So in 2003, I started to volunteer at that same time at Great Ormond Street Children's Hospital, which is one of the leading children's hospitals in the world. And I was volunteering there as a project manager for designing a touchscreen information system. And whilst I was there, I was kind of like just so shocked. I was walking around and all I could see was just so many massive opportunities for small pieces of design to really help improve the environment, the patient experience and communications. And so I started to bring on board other designers to look at these challenges and to run small design projects for no money, but just actually looking at how can we just use our creative talent to tackle these issues. And I was doing that for 9 months, and I thought, right, I want a job now, it's time to get paid. And so I asked them for a job, and traditional public sector, they said, there's no pay code for a designer, so I'm sorry we can't employ you. And you know what, I'm so glad there wasn't a pay code for the designer, because I then went on in 2004 and started my own company. So I kind of classify myself as a social designer, and what I mean by that is that I use design to look creatively at social issues and think about how we can solve them. I don't design products, so some of the stuff that I show today, I kind of have slide envy of everyone else here because their presentations are so beautiful. Quite a lot of our stuff isn't beautiful. It's more about how do you open up the design process and how do you get the public, people that have never experienced design before, to become your co-design partners. But also a lot of the work that we're doing now is actually how do they become our co-production delivery, so how do they become part of the delivery of the design too. And so I'll explain what I mean by that more in some of the projects. So as a company, our aims are to design creative solutions to social issues that deliver value and impact, to radically redesign public services and how they are delivered, and to activate people to realise their potential in society. And I think that one's a really big one, because if you don't have that belief, you can't actually change some of these big social issues. The clients that we work with include like the NHS, which is a national health service in the UK. So in the UK we have a free health service. Anyone can rock up at a hospital and get free service. I guess with that, it's an amazing service, but it also comes with the costs and challenges that go with that. We also work with local authorities, which are councils that provide services directly to residents. like housing services and refuge services. And we work with organisations like the lovely Design Council, which David was here earlier. I'm going to share two stories with you today. One is around looking at how designing new social enterprises with communities. And in the UK, the current government have a big agenda around big society and how you involve communities in creating new social enterprises to service local community needs. So actually, how do you encourage people to just talk to their neighbour? It's as simple as that. And then the other one is looking at how you can co-design a UK-wide support service for people with dementia and their families. And like we all know, there's a massive issue with the ageing population, and so there's a real challenge with that. So the first brief was set by a local council in North London called Barnet Council. And they came to us and said, okay, how can you design a community-led life coaching service to help families with complex needs achieve their goals and reduce their usage of public services? So we're kind of put in a position where we need to design something that works for people, but also reduce costs for the council. So in terms of the issues, complex families in the UK tend to access a wide range of public services. So one family might be accessing housing services, they might be accessing health services, they might be getting benefits, and the list goes on. There's a massive amount. So the direct cost of these families to the whole UK budget is around 41 billion per year. So it's a massive amount. Within one client within Barnet, 2% of these families were costing this one small London borough 87 million. So actually, how do we use design to reduce that cost, but also provide a better service? Because most of the services that are out there at the moment weren't really working properly anyway. So we started by looking at actually how do you design a community coach service? And what we mean by that is how do you support families with complex needs be able to build their confidence and resilience, but also reduce their uses of public services. So the model of a life coaching service, I don't know if everyone's familiar with that, but it's basically someone that helps you achieve your goals and aspirations. How do you train people in the community who are volunteers to be these life coaches, to work with these families? And so this is Jane, who is one of our community coaches. When I first met Jane, she said to me that we actually thought that she was one of the families which actually needed the support of the community coaches. But it ended up actually, as I was talking to her, I really found that there was such potential in her as an individual to be a coach. And within the model that we created, it was around actually helping more peer-to-peer. So with Jane, she said to be a community coach would really be the start of my life. And what we provided Jane with was some very simple skills and tools to go out and find a family and work with them to be able to coach them to actually feel confident in their life and to reduce their uses of services. So the outcomes of this, sorry I've not explained that amazingly well because I was expecting to show my animation. So the outcomes of what we've seen so far is that the creation of the community coach service has really encouraged and supported families to enable local residents to coach families with complex needs. But also we've worked alongside the council to look at actually what's the business model behind this, actually how should it be funded, but also how should it be owned. Because one of the things that the UK public service sector is always trying to do is reduce risk and cost. And so the design of this new service is based around the community owning it and delivering it, but also being able to be funded part by the council, but part by private funding too. So it's trying to bring in those new revenue streams to this service. But also in terms of prototyping, the council are going to keep using the prototyping approach to actually use and develop new services because they see it's a really important way of actually them being able to work with their residents and be able to involve their residents in a design process with them, rather than someone sitting in their office saying, this is what that person needs. They believe that actually using design, they can involve people in a much better way. So I'm going to move on to my second story, which is my last story, and this was a brief that we started with the Design Council and the Alzheimer's Society in 2007. The last story is still a work in progress, so we're only halfway through that project, but this project is a much older project, so we've started to see the benefits of this coming through. So we were asked to use design to improve people's lives living with dementia. In the UK, 1 in 3 people over 65 will die of some form of dementia. And 163,000 new cases of dementia occur in England and Wales each year, so that's 1 every 3.2 minutes, which is pretty scary. And currently, dementia costs the UK economy 23 billion per year, which is twice the cost of cancer, which we all kind of are pretty aware of cancer as an issue, but dementia is pretty unknown. So it just shows that there's a real need for design to start looking at actually how do we tackle some of these issues. So we, as a design team, we found the SMART team. It's a group of people with dementia and their carers, and they became our design team and worked alongside us. And one of the things that we do a lot of is we go out and we try to capture what it's like to live in their daily lives and to map their challenges, their daily challenges, and their kind of opportunities for where things could really help improve. And then we ran this over the whole of the North East in the UK, and then brought together a range of people to a co-design event. So a lot of the work that we do is around co-design and co-production. How do you bring together nurses, people with dementia, carers, professors, and a range of people to kind of really go, okay, this is what we've found out, this is what we understand that the people's challenges are. How can we collectively start to think about solving these challenges? So we created a range of design tools to prompt these discussions and start to map out the opportunities. So some of the early stage outcomes for this project included a clear need and opportunity for a dementia-style advisor service. So one of the big issues was actually that people post-diagnosis of dementia just didn't know where to go to get information. So it was a very simple thing, but that came out on top. There was also, as a result of the research and co-design concepts, they then fed up into the Department of Health's dementia strategy in 2009. And what we've seen a lot within our work is that actually we have to be able to communicate to policymakers. And as a designer, I didn't study that, so it's something that I've had to learn quite a lot on the way, but it's been amazing as a result of this project that then the government then released funds to make the concept that we'd created with people with dementia happen. So this is Mary, and she is one of the first dementia advisors in the UK, and we worked with the Alzheimer's Society to design a new service which helps people with dementia and their families once they've been diagnosed. And we designed the tools that Mary uses to help go out and have those conversations. We designed Mary's job role, we designed the IT system with the Alzheimer's Society that supports all of that and captures local data and rates that local data with local groups, people with dementia. And so the final outcomes from this project included that the government released 22 pilot sites across the UK, and with the design that we had created with people with dementia, the Alzheimer's Society won 18 of the 22 pilot sites. This brought in around 5 million worth of revenue to the Alzheimer's Society, which is really interesting. We do a lot of work with charities to think about how they can create new revenue streams, and so this is really, really good for the Alzheimer's Society. And then the Dementia Advisor Service now has 70 advisors in the UK and around 8,000 interactions with the service. So it's kind of up and running and working really well. And it's at the stage now where it's been predicted to have reduced the amount of usage on emergency services. So it's really showing that actually via design you can not only service people better, but you can also save money as well, which is really important in the UK at the moment. So my final reflections are around the changing face of design is that I guess as designers, we really have a responsibility to use our creativity to tackle the world's biggest social issues. And I think we're really starting to see that through some of the presentations today. We also have to, I think, as designers, learn to work with government and communities and start to develop a new language in order to do that, because we can't work in silos without actually being able to connect with those, particularly when tackling social issues. And then finally, I think that we need to think and act like social entrepreneurs when creating solutions. We need to think about what's the business case behind an idea and how is it going to become sustainable, how is Mary going to be able to deliver that, and what's her role within that, and how does she get paid? Because there is money there, we just need to think of new ways of funding things. So just finally to finish, if you could, I guess, think on this question again, if you could design anything to improve the way we live, what would it be? Thank you.